How can we address identified gaps in care for paper practices in our ACO?
Makes great sense to me to use your quality analyses to improve your performance. And it needn't look much different at its highest level for paper versus electronic practices. We should be exchanging data at least quarterly and perhaps as often as monthly. You will provide to us the latest claims and clinical data, and we will process the quality performance analyses with the same logic we apply to the final annual report to Medicare. You will have access on our dashboard to a year to date quality performance score on each measure. On our dashboard, you will be able to drill through to scores by practice, scores by provider, performance for each patient on each measure. I suggest that you download a list of patients in the performance not met status for each measure for each practice. Remembering when I say performance not met, I'm in the background flipping the polarity of the inverse hemoglobin A1C measure. Where higher scores are worse performance. So think of it in those terms. Now, someone in your ACO, or perhaps in each practice, and maybe it's preferable in each practice, should work those lists. There are a number of options, and you will want to choose what works best in your environment. You can have someone reach out to each of the patients with gaps and schedule things remotely, provide remote services, provide hemoglobin A1C testing or referral for a blood pressure check or medication adjustment. You can accelerate the next visit to address the gaps, or you can add a note to the chart or the schedule reminding the practice, reminding the provider to fill the gaps at the next visit. You can achieve best performance by using the analytics to inform your next encounter. Now, as we work together and as we get used to exchanging data, ultimately, I'd like to see this data become more and more real time, and ultimately insert it into your EMRs for workflow enhancement. This data should ultimately be not only your feedback for reporting, but also your feed forward decision support. But that's doing it perfectly now gets in the way of you doing a great job in submission to earn your shared savings.